She had worked 60-hour weeks. She had caught the medication error that would have stopped a 7-year-old's heart. She had stayed late, come in early, and said nothing when the credit went to someone else. And on a Tuesday morning in October, they took her badge anyway. "You're a liability," the chief surgeon said, loud enough for the whole nurses' station to hear. "Pack your things." Security walked her out like she'd stolen something. 43 minutes later, the hospital's emergency line lit up with a mass casualty event, and the administrator who signed her suspension paperwork was about to discover that the woman they just humiliated was the only person inside Ravenwood General trained to handle what was coming. Before we go any further, if you're new here, hit that subscribe button right now, because the story you're about to hear is exactly the kind we tell on this channel. Real pressure, impossible situations, and the people everyone underestimates proving every single doubter wrong. Drop a like if you're already feeling it, and I want you to leave a comment below telling me what city or country you're watching from, because I want to see exactly how far this story travels. Now, let's go back to the beginning. The first thing most people noticed about Mara Solis was how still she moved. Not slow, still. Like someone who had learned a long time ago that panic was expensive and she couldn't afford it. She walked the corridors of Ravenwood General Hospital in Draper's Crossing, Wyoming, with the kind of quiet efficiency that made new nurses nervous and made experienced ones pay attention. She didn't rush. She didn't freeze. She simply moved from task to task with the focused economy of someone who had once done this work in places where running out of supplies meant people died on the floor. Nobody at Ravenwood knew about those places. That was more or less the point. She had come to Draper's Crossing 14 months ago, answering a posting for a mid-level trauma nurse with ER experience. She listed her nursing degree from the University of Arizona, her 7 years of civilian hospital work in Phoenix, and a gap in her employment history that spanned 3 years and which she described, when anyone asked, as personal leave. Her references were clean. Her record was spotless. She passed every background check, every skills evaluation, every credentialing review. What the credentialing review did not surface, because it had been buried under classification layers that most federal agencies couldn't access without a specific court order, was that Mara Solis had spent those 3 missing years as a U.S. Army Special Operations Trauma Specialist, deployed across 4 active conflict regions, holding the rank of Staff Sergeant under a unit whose operations were still sealed. Before the gap, before Phoenix, before any of it, she had been one of the most capable field medics the Army had trained in a decade. She had also been court-martialed, acquitted, eventually, but the process had taken long enough, and the damage to her record had been deep enough that she'd quietly separated from military service and tried to build something ordinary. Something quiet. A hospital in a mid-sized Wyoming town where nobody would ask too many questions, and the emergency calls were mostly farming accidents and winter falls. She had miscalculated one thing. She had not counted on Dr. Preston Alcott. Alcott was the chief of surgery at Ravenwood General, 48 years old, Harvard-trained, and accustomed to the particular kind of authority that came from being the most credentialed person in any room he entered. He was not a bad surgeon in the technical sense. His outcomes were acceptable. His complication rates were within normal ranges. But he had spent enough years being deferred to, enough years having nurses step back and doctors nod, that he had developed a specific intolerance for anyone who failed to do the same. Mara failed to do the same approximately 3 times a week. It started small. 6 weeks into her posting, she flagged a medication dosage on a post-surgical patient, a 72-year-old man named Elvin Marsh, who'd had a hip replacement and was about to receive twice the appropriate anticoagulant due to a transcription error. She caught it during her medication check, corrected it before it reached him, and documented it properly. The attending, a hospitalist named Dr. Loretta Payne, thanked her. Standard process. Nothing dramatic. But the error had originated from Alcott's verbal order, miscommunicated down the chain, and when Alcott reviewed the incident report, he did not see a near miss averted. He saw his name attached to a documented error. He called Mara into his office the following morning. "You flagged this report with excessive detail," he told her. "A note in the chart would have been sufficient." Mara looked at him evenly. The documentation protocol requires incident reports for medication errors above a certain threshold, The dose discrepancy qualified. I'm aware of protocol, Nurse Solis. Then we're in agreement, she said, and waited. He dismissed her, but his eyes stayed on her back as she walked out. The second incident happened 3 weeks later. Alcott was preparing to perform a diagnostic procedure on a patient, a 44-year-old woman named Darla Fitch, admitted for abdominal pain, and Mara, reviewing the prep documentation at the nurse's station, noticed that the patient's most recent renal panel hadn't been reviewed. Fitch's creatinine was elevated, not critically, but enough that the contrast dye Alcott was planning to use for the imaging portion of the procedure created a genuine risk for acute kidney injury. She sent a message through the system to the charge nurse, who brought it to the attending. The attending brought it to Alcott. Alcott paused the procedure, ordered a repeat panel, adjusted his approach. The patient was fine. Afterward, he found Mara in the supply corridor. "You went around me," he said. "I went through the charge nurse, which is the correct reporting chain for a pre-procedure safety concern." "Don't be clever with me." "I'm not being clever," she said. "The protocol exists for situations exactly like that one." He left without responding, but 2 days later she found her schedule had been shifted. Less trauma bay time, more long-term floor coverage. It wasn't a punishment anyone could formally document, just a quiet rearrangement. She noted it and said nothing. The third incident was the one that ended things. It was a Monday. A 14-year-old boy named Danny Kowalski had come in through the ER the previous evening. A skateboarding accident, a bad fall, a head laceration that had been cleaned and sutured overnight. He'd been kept for observation, and by Monday morning he was technically stable. But Mara, doing her morning rounds on the observation ward, thought something was off. His vitals were within normal range. His pupils were equal and reactive, but he was sluggish in a way that wasn't quite right. Not the sluggishness of a teenager woken at 6 in the morning, but something quieter, something that sat underneath his responses and made them slow in a specific way she recognized from a long time ago and a very different place. She pulled his chart. She reviewed the fall documentation. She pressed gently on the area behind his left ear and watched his face tighten. She paged the overnight neurologist, who had already signed off and was heading home. The neurologist, a Dr. Marcus Webb, was annoyed. He'd cleared the kid. He'd done his assessment. He told her over the phone that her concerns were noted and she should escalate through the attending if she felt it was necessary. She went to the attending. The attending reviewed Webb's notes and agreed the kid looked okay. Mara went back to Danny's bedside. She sat down next to him. "Hey," she said, "I know you're tired. I need you to look at me for a second." He turned his head and she watched the motion, the slight delay, the careful way he tracked. She went to the nursing station and ordered a repeat neurocheck, documented her observations in the chart, and put in an urgent flag on the case. Then she called the neurology department directly, not Webb, but the department chief, and described what she was seeing in language she was not supposed to use, using terms that did not match the scope of her nursing role, and that made the department chief ask, very carefully, where she had trained. "Wyoming State," she said, because that was partially true. The department chief came down 20 minutes later. Within the hour, Danny Kowalski was in CT, where they found a slow subdural bleed, the kind that looked fine overnight and became fatal by afternoon. He was in surgery within 2 hours. He survived. The neurology chief sent a formal commendation to hospital administration. The attending documented Mara's early identification as a contributing factor in the positive outcome. It should have been a clean, good story. But Preston Alcott had also reviewed the chart. And what he saw, underneath the positive outcome, was a nurse who had called the department chief directly, bypassing the attending, bypassing Webb, operating passam in his assessment, well outside her sanctioned scope of practice. He brought it to the administrator, a man named Gordon Fisk, who had been Alcott's ally since they'd sat on the same hospital board committee 3 years ago. Fisk reviewed the incident with the careful thoroughness of someone already looking for a specific conclusion. The formal complaint landed on Mara's file 4 days later. Failure to follow chain of command, scope of practice concerns, pattern of undermining physician authority. She was called into Fisk's office on a Tuesday morning. Alcott was there. So was HR. Mara sat down. She read the document they placed in front of her. She read it carefully, and when she was finished, she looked up at Fisk. "This complaint characterizes my actions in Danny Kowalski's case as a scope violation," she said. "He had a subdural hematoma. He's alive." "The outcome isn't in question," Fisk said. "What is in question?" "Your conduct, your repeated pattern of circumventing physician authority. We've received concerns from multiple members of the medical staff." "Which members?" Fisk glanced at Alcott. "That's not information we're required to." "I understand you're not required to," Mara said. "I'm asking." Silence. She looked at Alcott. He met her eyes and didn't look away, which she gave him credit for. "You have two options," Fisk said. "A formal disciplinary process, which will take several weeks and will be on your permanent record, or an immediate voluntary suspension while we conduct a review. The second option is cleaner." "Cleaner for whom?" Nobody answered. Mara was quiet for a moment. Then she said, "I'm not going to resign." "Nobody's asking you to resign." "You're asking me to make it easier to eventually ask me to resign." She looked at the suspension document. "I'll take the formal process." Fisk's expression shifted. Something flatter, less patient. "That's your right. In the meantime, pending the initiation of formal proceedings, you're suspended effective today. You need to surrender your badge." She looked at him, then at Alcott. Alcott reached across the table and, without a word, slid the badge holder toward himself. Mara stood. She picked up her bag. She did not say anything else because there was nothing left to say in that room that would accomplish anything, and she had learned a long time ago the difference between words that cost you and words that spent something. She walked out. In the corridor, one of the younger nurses, a second-year named Priya, who had shadowed Mara on 3 different shifts, was watching from the nurses' station. Priya opened her mouth. Mara shook her head once, gently, and kept walking. The security guard who walked her out was named Todd. He looked uncomfortable. She didn't make it worse for him. "I know the way," she said. "I still have to—" "I know. It's okay." They walked to the main exit together. The morning light outside was sharp and cold, the Wyoming October doing what Wyoming October does. She stood in the parking lot for a moment, keys in hand, watching the automatic doors close behind her. 14 months of quiet, careful work. A 14-year-old alive in a recovery room upstairs. And a badge inside, in Preston Alcott's hand. She got in her car. She sat for a moment with her hands on the wheel. Then she started the engine and pulled toward the exit. She was halfway down the access road when the sound reached her. Not a bang, not exactly. More like a pressure shift, felt in the chest before it registered in the ears. The kind of concussive displacement that didn't happen with car accidents or gas leaks, or any of the ordinary emergencies that sent people to ERs in Wyoming. She stopped the car. In her rearview mirror, a column of dark smoke was rising from the industrial district 3 miles southeast. Black and dense, the kind of smoke that meant something structural, something chemical, something that was still burning. Her phone buzzed. A statewide emergency alert. Explosion reported. Harwick Processing Facility. Multiple casualties suspected. All emergency services en route. She sat very still for 4 seconds. In those 4 seconds, she ran a rapid automatic inventory. Ravenwood General was the only Level 2 trauma facility within 40 miles. The Harwick Processing Facility employed over 200 workers per shift. A structural explosion at a chemical processing plant in an enclosed industrial campus meant blast injuries, burn trauma, toxic inhalation, crush injuries from structural collapse. A specific, brutal combination that required a specific kind of management that was not taught in standard ER residencies and was not covered in civilian trauma nursing curricula. It was, however, something she had managed before, more than once, under significantly worse conditions. Her phone buzzed again. A second alert. Then a third. Mass casualty event confirmed. Estimated 60 to 80 injured. She put the car in reverse. The drive back to the hospital entrance took 40 seconds. She parked, got out, and walked through the main doors. The lobby was already shifting. That specific frequency change in ambient noise that preceded an emergency surge, staff moving faster, voices tightening, the charge nurse at the main desk speaking rapidly into a phone. Mara walked past the desk toward the trauma bay entrance. "Hey." The security guard by the door, not Todd, a different one, stepped forward. I was told you were. There's a mass casualty event inbound," Mara said without stopping. "First ambulances will be here in under 12 minutes. You can call Fisk or you can get out of my way." He hesitated. She didn't. She pushed through the trauma bay doors. Inside, the ER was already beginning to fracture. Two attending physicians, both hospitalists, not trauma specialists, were standing at the whiteboard looking at each other with the particular expression of people who had just been handed a problem significantly larger than anything they'd been trained to manage. 3 nurses were pulling crash carts. Someone was on the phone with the state emergency line. The overhead PA was cycling through a call for all available staff. Dr. Alcott was standing near Bay 4. He saw Mara come through the doors, and his face went through 3 expressions in quick succession. Surprise, anger, something harder to identify. "You're suspended," he said. "I know." She moved to the supply counter and pulled a pair of gloves. "What's your mass casualty protocol?" "That's not your—" "Preston." She turned. She used his first name without planning to, the way she'd spoken to officers in forward operating bases when there wasn't time for rank. "You have hospitalists and floor nurses about to receive 60 to 80 blast trauma patients. Do you want to have this conversation, or do you want to start setting up?" He stared at her. From outside, distantly but clearly, the first siren became audible. Then a second. Then several, converging. "What's your blood bank capacity right now?" she asked the charge nurse, a woman named Deb Haverford, who had been at Ravenwood for 11 years. Deb looked at Alcott. Alcott said nothing. Deb looked back at Mara. 36 units O-neg on hand, Deb said. "Cross-match will take. Call the blood bank now and tell them to start thawing everything they have. Set up secondary IV lines in every bay, not just primary. If you have spare gurneys in storage, get them into the corridor. We're going to run out of bay space inside 20 minutes. She pulled on her gloves. "Who's your most experienced trauma nurse on shift?" "Probably Marcus. He's got 7 years trauma." "Get Marcus to Bay 1 and have him set up for penetrating chest injuries. That's going to be your highest acuity category from a blast event. Second priority is burns. Do you have a burn protocol kit?" "We have a limited one. We're not a burn center." "I know. Set it up anyway. Anything you have." She moved toward the bay entrance, scanning the space, reading it the way she'd been trained to read it. Exits, bottlenecks, supply access points, sight lines. "Toxic inhalation cases will need respiratory. Where's your RT on shift?" "Janelle, she's on 3. Get her down here." "You're suspended," Alcott said again, but his voice had changed. The edge was still there, but underneath it was something Mara recognized. Not agreement, not concession, but a man watching a situation move faster than his authority could keep up with. "Yes," she said, "I am. And those sirens are about 2 minutes out." She looked at him directly. "You can have me escorted out again. That's your call, and I'll go. But if I leave, you're running this with what you've got, and what you've got isn't enough for what's coming." The automatic doors at the ambulance bay burst open. The first gurney came through at a run. A man in his 40s, industrial coveralls torn and scorched, his face a mask of blood and particulate, 2 paramedics calling his stats over each other. "Blast injury proximal, BP's dropping, we've got suspected internal, airways intact, but..." Mara was already moving. "Bay 1, she said, and her voice carried across the room with a clarity and weight that stopped everyone who heard it. Not loud, not sharp, just certain. "Get a second large bore IV in his left AC, draw a rainbow, type and screen. Someone get me a fast probe." She was beside the gurney before it stopped moving, her hands already on the patient, her eyes running a rapid assessment with the speed and precision of someone reading a language she'd been fluent in for years. Behind her, she heard movement, feet, equipment being pulled, the specific sound of people shifting from paralysis into action. She did not look back to see if Alcott was watching. She already knew. The second ambulance pulled in as she was stabilizing the first patient, then the third. By the time the fourth arrived, the ER was running. Not smoothly, because nothing about a mass casualty event runs smoothly, but it was running, which was different from what it had been 2 minutes ago. Mara moved between bays with the fluid economy that had once earned her a citation she was no longer officially allowed to display. She assessed. She directed. She caught things. A tension pneumothorax developing in Bay 3 that the resident had missed. A chemical burn on a patient's arms that looked superficial but was already showing signs of systemic absorption. A man in the corridor whose outward injuries were minor but whose mental status was deteriorating in a way that pointed to blast concussion. She spoke to the young doctors the way she had once spoken to junior medics in the field. Directly, specifically, without condescension, but without softening. Get a chest tube ready. Yes, now, no, the left side, but listen. A pause. There. You hear that? The resident nodded, his face pale but focused. That's what attention sounds like before it kills someone. You've got maybe 4 minutes. Move. He moved. Priya, the second-year nurse who had watched Mara walk out 90 minutes ago, appeared at her elbow halfway through the second wave of arrivals. What do you need? Priya asked. Mara looked at her. You know how to set up a burn irrigation line? I've done it twice. Bay 6. There's a woman in there with chemical burns on her torso. She needs continuous irrigation and someone monitoring her systemic response. You comfortable? Yes. Go. Priya went. Dr. Alcott had stopped trying to manage the floor from the periphery and had scrubbed in, operating on a patient with penetrating abdominal injuries in OR2. Mara was aware of his absence from the ER floor the way she was aware of all the variables, not with feeling, just with the matter-of-fact clarity of a triage mind running its calculations. She was on her 41st patient, a woman in her late 30s, suspected pelvic fracture, BP trending down, when Gordon Fisk appeared at the trauma bay entrance. He stood there for a moment, watching the controlled chaos, watching Mara at its center. His expression was the expression of a man who had made a decision that morning and was now watching the consequences of that decision unfold in a way that required him to reassess. He caught Deb Haverford's eye, said something to her quietly. Deb came to Mara's elbow 2 minutes later while Mara was directing a portable X-ray setup. Fisk wants to speak with you, Deb said quietly. Tell him I'm busy. I think he wants to, Deb. Mara's eyes didn't leave the patient. I'm in the middle of a mass casualty event. Whatever Gordon Fisk wants to discuss can wait until the last ambulance comes through that door. Tell him I said that exactly. Deb relayed the message. Mara didn't watch to see Fisk's reaction. She didn't need to. She was on her 53rd patient when the sound changed outside. Not sirens this time. Something lower, rhythmic, heavy. A sound she would have recognized in a blindfold, in the dark, in the middle of anything. Rotor wash. She paused for just a fraction of a second. The first pause that wasn't purely clinical since she'd pushed through the trauma bay doors. A helicopter, military, close, getting closer. Through the trauma bay windows, she could see the skyline above the parking structure, and against it, descending toward the hospital's rooftop landing pad, was a Black Hawk with army markings. She stared at it for 1 second longer than she intended. Then she turned back to her patient, because the patient was still in front of her and the patient still needed her, and whatever was on that helicopter was going to have to wait. But her hands, for the first time all morning, weren't entirely steady. Her hands steadied themselves the way they always did. Not by force, but by necessity. The body understanding before the mind caught up that there was no margin here for anything except the work in front of her. The woman on the gurney, her name was Teresa Okafor, according to the intake tag the paramedics had clipped to her wrist, was 37 years old and had been standing 40 feet from the secondary detonation point when the Harwick facility's Eastern Processing Unit blew. The blast wave had caught her sideways, which was why she was still conscious. It had also driven her left hip into a structural beam on her way down, which was why her blood pressure had been trending the wrong direction for the last 8 minutes. Mara ran her hands along Teresa's pelvis with the careful, systematic pressure of someone who had done this assessment in the dark, in the rain, with incoming fire in the background. She felt the instability before the imaging confirmed it, a subtle wrongness in the pelvic ring, the kind of thing that looks unremarkable on a cursory exam and kills you when the internal bleeding it's been hiding decides to announce itself all at once. Get me a pelvic binder, she said to the nurse at her left, a man named Garrett, whose hands had been shaking 20 minutes ago and were steadier now. We've got one, yeah? And get ortho on the phone. She's going to need surgical stabilization within the next hour. This isn't going to hold. Garrett moved. Mara kept her hand on Teresa's arm because Teresa was awake and looking at her with the particular expression of someone who understood that the situation was serious and was working very hard not to show how frightened they were. You're doing well, Mara said, which was not a platitude. Teresa's vitals were holding, which in this context was a genuine accomplishment. I know it hurts. We're going to give you something for that in a minute. I had a coworker, Daryl. He was right next to me. Teresa's voice was thin but controlled. Is he? I don't know yet, Mara said. That's an honest answer. Let's focus on getting you stable, and then we'll find out about Daryl, okay? Teresa nodded and looked at the ceiling and didn't say anything else. Mara straightened, turned, and nearly walked into Gordon Fisk. He was standing directly behind her, closer than she'd realized, which meant he'd moved from the doorway while she was focused on the patient. He was a trim, careful-looking man in his early 50s, the kind of administrator who wore his suit like armor and whose entire professional identity was built around maintaining a specific kind of control. He did not look like that right now. He looked like a man who had spent the last 40 minutes watching something happen that he hadn't prepared for and couldn't stop. Nurse Solis, he said. Mr. Fisk. She was already moving, stepping around him toward Bay 7, where she could see a paramedic waving for attention. I told Deb. I heard what you told Deb. He fell into step beside her, which she hadn't invited. I need a moment. You're going to need to walk and talk then. He walked. He didn't talk immediately, which told her he was choosing his words, which told her this was going to be a specific kind of conversation. Bay 7 held a man she placed in his late 50s, heavy-set, industrial burn pattern across his right arm and shoulder, secondary lacerations on his face and neck, vitals that looked deceptively okay for someone who'd been within 30 feet of a chemical detonation. She assessed him in the first 10 seconds and directed the attending, a young ER doctor named Dr. Faraday, who'd been useful and hadn't tried to resist her direction, to check his respiratory function carefully. Chemical burns and inhalation injuries ran together at Harwick, and the toxicology reports on what exactly had been burning in that facility were still pending. I need to know what we're dealing with toxicologically, she told Faraday. Get me whatever the fire department's hazmat team has on the facility's chemical inventory. That should have gone to your incident command the minute this started. I'll get it, Faraday said. Good. Fisk was still beside her. She moved toward the corridor, checking the board, running her count. 54 patients through the door. The wave was slowing. The second surge was mostly processed now. The third would depend on what was still happening at the site. She pulled out her mental estimate and revised it. Maybe 15 to 20 more coming, depending on secondary structural damage. I want to reinstate your badge, Fisk said. She kept looking at the board. You're suspended, he continued, and his voice had gone somewhere odd. Not apologetic exactly, but stripped of its earlier certainty. Technically, you shouldn't be in here right now. Legally, we're in a complicated position. Gordon? She didn't look at him. Are you reinstating me, or are you explaining why you can't? A beat. I'm reinstating you, he said. Effective immediately. The formal review is suspended pending. Give me back my badge and get out of the trauma bay, she said. Not harshly, just clearly. You can give me paperwork later. He reached into his jacket pocket. She hadn't noticed the badge was there, that he'd retrieved it from Alcott's office, which meant he'd done that before coming out here, which meant he'd already decided before he crossed the floor. He held it out. She took it, clipped it back onto her scrub pocket without looking at it, and walked toward Bay 9. Fisk stood in the corridor for a moment, and then walked back toward administration, and that was that. The next 40 minutes were the densest of the morning. The third wave of Harwick casualties arrived in overlapping clusters. Workers who'd been evacuated from secondary areas and were showing delayed symptom onset, the particular cruelty of blast injuries and chemical exposure, combining on a 2 to 3 hour delay after the initial event. Mara caught 2 cases of developing pulmonary edema from inhalation exposure, a spinal injury in a man who'd been telling everyone he was fine since he walked in, and a young woman, 19, a part-time processing technician named Kessie, who'd been on her second shift ever, who was sitting in a hallway chair presenting as shock without apparent physical injury, and who turned out to have a small pneumothorax that had compressed slowly enough that she'd walked in under her own power and was now the most urgent case in the corridor. "You walked past her," Mara said to the triage nurse, not accusingly, just stating the fact. She looked okay. She wasn't. She pulled Kessie into the nearest available space. "I need a needle decompression kit, and I need it now, and someone get Dr. Faraday." Kessie looked at Mara with the wide, slightly unfocused eyes of someone whose oxygen levels were dropping faster than her body was registering. "Am I dying?" Kessie asked. Her voice was very small. "No," Mara said. "But you're going to feel a lot better in about 90 seconds. Hold still and hold my hand if you need to." Kessie held her hand. Mara performed the needle decompression with the controlled, precise speed of someone who had done it in conditions where 90 seconds was a luxury, talking Kessie through it in a low, even voice that had nothing to do with the clinical calculations running simultaneously in the other half of her mind. When the pressure released and Kessie's oxygen saturation began climbing back toward functional range, Mara felt the specific, uncomplicated relief of a problem solved cleanly. No ceremony to it, just the satisfaction of the right outcome. Faraday arrived 30 seconds too late, which she didn't comment on. "Get a chest tube in and get her upstairs," she told him, and moved on. It was Deb Haverford who first mentioned the helicopter. She appeared at Mara's shoulder between patients in the brief operational gap between the third wave and whatever was coming next, and said in a voice pitched low, "The bird that landed on the roof, they're down in the lobby, 4 of them. Military. They asked for you by name." Mara stopped walking. "By name?" "Mara Solis," Deb said. "I heard it directly. One of them showed credentials to the front desk. The other 3 waited by the elevator. They're not regular Army, Mara. I've seen military consultants come through here before. These aren't consultants." Mara looked at the board, looked at the bay doors. Did the math on what was still unresolved in the ER versus what stable coverage Faraday and the other attendings could manage without her? "Who else knows they're here?" "The front desk. Me. Probably Fisk by now." She didn't say anything for a moment. Then, "Tell them I'll be up in 20 minutes. They said it was—" "I know what they said." She was already moving toward Bay 12, where a man in his 60s with a suspected cardiac event complicating his blast injuries had just triggered a monitoring alarm. 20 minutes? Deb went. The cardiac case took 16 minutes. A non-ST elevation event, stress-induced, the man's underlying coronary disease deciding that today was the day to make itself known. She stabilized him, got cardiology on the phone, arranged transfer to the cardiac floor, and handed off to Garrett, who had found his footing in the last hour and was now operating with the quiet competence of someone whose skills had always been there but had needed the right pressure to surface. "You've got this," she told him, and she meant it. She peeled off her gloves, washed her hands at the corridor sink, and looked at herself in the small mirror above it for a brief moment. Her face was the face of someone who had been running on adrenaline and trained discipline for the last 2 hours and 40 minutes. She looked tired. She searched for the word and settled on present, which was the best she could claim right now. She went to the elevator. The lobby, when she stepped out, had settled into the specific quiet of a space that's been recently hectic and is now holding its breath. A few families clustered near the information desk. A volunteer coordinator moved between them. The TV mounted on the far wall was showing aerial footage of the Harwick facility, the smoke column still visible from the news helicopter's angle. The 4 people Deb had described were standing near the window, not seated, which told her something. 3 of them were in combat utilities, the kind of quiet, unmarked operational wear that didn't advertise branch or unit but communicated military in every line. The 4th was in dress uniform, and even from across the lobby, Mara could read the insignia. She stopped walking for half a step, then kept going. Brigadier General Annette Rourke was 61 years old, with the kind of face that had been weathered by decades of things she couldn't talk about in most rooms. She had been Mara's commanding officer for 18 months during the second of Mara's deployments, before the restructuring that had moved Mara to the unit under Colonel Dermot Sloan, the restructuring that had indirectly put Mara in the position to be blamed for what happened 18 months later. Rourke saw Mara cross the lobby, and her expression did something complicated. Not surprise. Rourke was not someone who showed surprise easily. Something more like the look of a person who has carried a weight for long enough that setting it down feels strange. "Sergeant Solis," Rourke said. "I'm a civilian nurse," Mara said, and her voice came out steady, which she was grateful for. "You're a staff sergeant who was separated from service under a fraudulent proceeding," Rourke said, quietly enough that it didn't carry. "And yes, I know what I just said." The lobby was not the right place for this. One of the three others, a man in his 30s, sharp-eyed, the kind of calm that came from specific training, gestured toward a conference room off the main corridor that was apparently already unlocked and waiting. She looked at Rourke. Rourke nodded once. They went into the conference room. The sharp-eyed man pulled the door. The other two took positions without being asked, which was not bodyguard behavior. It was coordination. These were not Rourke's aides. They were something else. "Sit down if you want," Rourke said. She didn't sit herself. Mara didn't sit either. Old habit. "How did you find me?" Mara said. It wasn't exactly a question. "We've known where you were for 6 months," Rourke said. "I want to be honest with you about that. The decision about when to make contact was more complicated." 6 months. Mara processed that. "You watched me. We monitored. There's a difference, and I won't pretend it's a comfortable one." Rourke's jaw was set. "What happened to you in the Sloan investigation was wrong. I want to say that directly and without qualification. The charges that ended your career were fabricated, and the people who fabricated them have been under federal investigation for the last 14 months. The room was very quiet. Mara looked at the table surface, some kind of laminate wood pattern scuffed at the corners, the kind of conference table that had hosted thousands of ordinary meetings. She looked at it because she needed something to anchor to while she processed what Rourke had just said. Fabricated. She had known it, of course. She had known it the way you know something when you were there and the official account doesn't match what you saw with your own eyes. But knowing it and hearing it said out loud by a brigadier general in a conference room in Wyoming were different experiences. "What investigation?" she said. "Defense Procurement Fraud Task Force," the sharp-eyed man said. She looked at him. "Special Agent Dario Vance, NCIS. I've been primary on this case for 22 months. He said it without fanfare, just information. Colonel Sloan was running a ghost contract scheme through 3 logistics contractors with DoD authorization. When you identified the discrepancies in the supply chain records during the Corrigan mission, you became a problem for him. She remembered Corrigan. She remembered the numbers that hadn't added up and the report she'd filed that had been, she'd been told, reviewed and found insignificant. She remembered thinking the review had been too fast. "He buried the report," she said. "He buried the report and then he built a case to bury you," Vance said. "The incident in the forward staging area, the one you were court-martialed for, was staged. 2 of the witnesses have since recanted. One of them came to us voluntarily." Mara's mouth was dry. She had spent 3 years believing that the truth existed somewhere in a classified file she'd never be allowed to see, that the truth would stay buried because buried things stayed buried when powerful people needed them to. She had built a new life on the assumption that some things don't get fixed. "Why now?" she said. Rourke answered. "Because Sloan's network extends beyond the military. One of his contractors has connections to hospital supply chain fraud, specifically a company called Meridian Healthcare Logistics, which has contracts with approximately 40 regional hospitals across the Mountain West." A pause. "Including this one." The silence stretched. Mara looked up from the table. "Ravenwood," she said slowly. "Ravenwood General has been awarding Meridian supply contracts for the last 4 years at prices significantly above market rate," Vance said. "The kickback structure runs through a holding company connected to your hospital administrator, Gordon Fisk." She thought about the badge in his jacket pocket. She thought about the careful, controlled way he operated, the way he and Alcott moved around each other like 2 pieces of a machine that had been running too long for anyone to question it. You came here for me or for Fisk? She asked. Both, Rourke said, but not in the way you might think. She finally sat down, across from where Mara was standing. The procurement case against Sloan is solid. We don't need you as a witness. We have the documentation. What we need from you is a decision. Mara waited. Your discharge can be reversed, Rourke said. Your record can be cleared, your honors restored. The Army is prepared to offer a formal reinstatement with backdated service credit. You'd resume at Staff Sergeant with time toward E7 counted from separation. She said it carefully, watching Mara's face. Or you stay civilian. We clear your record regardless. That's not conditional on your decision. But the reinstatement is an offer, not an obligation. Mara stood very still. 3 years. 14 months in Wyoming pretending to be a different version of herself. Watching Danny Kowalski's chart deteriorate while a neurologist told her she was overstepping, and knowing with a certainty built from places she couldn't name, that she was right, and doing it anyway because the alternative was a 14-year-old dying because she'd been too cautious about her role. Sloan, she said. What happens to Sloan? Federal charges are being filed this week, Vance said. Procurement fraud, obstruction, falsification of military records. The DOJ is coordinating with JAG. And the witnesses who testified against me? Included in the obstruction charges, Vance said. Both of them. She looked at Rourke. You said you've known where I was for 6 months. Why did you wait until today? Rourke was quiet for a moment. Then she said something Mara hadn't expected. Because you had a life here. I didn't know if disrupting it was something I had the right to do, even to fix something that should have been fixed years ago. I was waiting to see if you were okay. The honesty of it landed strangely. Rourke had never been someone given to sentiment. 18 months of deployment had made that clear. But there it was, sitting in the fluorescent light of a hospital conference room in Wyoming, genuine and uncomfortable. Mara sat down. I need time, she said. You can have it, Rourke said. We're not going anywhere tonight. The sharp-eyed man, Vance, pulled a folder from the bag at his feet and set it on the table without opening it. There's something else, he said, and I want to be straight with you about what it is before you look at it. He tapped the folder. Fisk isn't just connected to Meridian through kickbacks. The supply contract fraud has been directly affecting patient care. Expired medication substituted under rebranded packaging. Substandard equipment passed through with falsified inspection records. He paused. We have documentation of at least 3 adverse patient outcomes in the last 2 years that are potentially attributable to compromised supply chain materials. Mara looked at the folder. At this hospital, she said. At this hospital. She did not reach for it immediately. She sat with it for a moment, the way she'd sat in her car 43 minutes after she'd driven out of this parking lot. Not paralyzed, just needing the space to let the weight of it settle before she picked it up. Then she reached across the table and opened it. The first page was a supply chain audit with Ravenwood's contract reference numbers. The second was an internal Meridian memo that she was reasonably sure Meridian had not intended to survive in any discoverable format. The third was a list of dates, adverse event codes, and a column of numbers that were medication lot numbers cross-referenced against a falsified inspection log. She read through it with the methodical attention of someone who had once reviewed mission documentation under time pressure and learned that the details that killed you were always in the middle pages, never the first and never the last. She was on the 4th page when she stopped. There was a patient name, a case from 14 months ago, her first month at Ravenwood. A 68-year-old woman named Ruth Kavanaugh, admitted for a routine procedure, who had developed a post-operative infection that had been treated as a standard complication and had not, according to the file, been flagged as potentially connected to supply chain issues. Mara remembered Ruth Kavanaugh. She remembered the infection because she'd been the nurse on shift when it developed, and she'd flagged the unusual presentation to the attending, an atypical inflammatory pattern that she hadn't been able to explain clinically at the time. She'd written it up. The attending had documented it as a standard post-surgical complication. Ruth Kavanaugh had spent 11 days in the hospital instead of 3, had developed renal complications from the antibiotic course required to clear the infection, and had been discharged with reduced kidney function that her family had been told was an unfortunate but not uncommon outcome. She had been using compromised suture materials, according to the Meridian audit, materials that had been stored improperly and repackaged under a falsified inspection batch number. Mara set the page down. "How many people knew about this?" she said. "About the supply chain specifically?" "We believe Fisk, possibly one other administrator. The physicians were almost certainly operating in good faith with the materials they were given." Vance said it plainly. "The culpability structure is designed that way. The people at the top know. The people doing the work don't." She thought about Preston Alcott. She thought about his arrogance, his certainty, his absolute conviction that he was always the most competent person in any room. She thought about whether that certainty could coexist with knowing about compromised materials, and she landed reluctantly on probably not, which made him an unwitting instrument rather than a knowing one, which was a more complicated thing to sit with than simple villainy. She closed the folder. She was about to say something when the conference room door opened and Deb Haverford put her head in. Deb looked at the military personnel, at Rourke's uniform, at the folder on the table, and visibly filed everything away for later processing. "I'm sorry to interrupt," Deb said. "Mara, we've got something." She paused. "The hazmat team got us the Harwick chemical inventory. There were 2 compounds stored in the Eastern Processing Unit. One of them is a chlorine derivative. We've got 6 patients who are closest to the east side, and all 6 of them are showing progressively worsening respiratory status." Another pause. "Dr. Faraday doesn't know how to manage chlorine derivative inhalation toxicity. None of our attendings do." Mara was already standing. She looked at Rourke. "We'll finish this later." "Go," Rourke said. She went. The corridor outside was faster than she would have liked. She could hear the difference in the ER before she pushed through the trauma bay doors, a specific pitch of elevated activity that meant something had shifted. Faraday met her at the door, his face doing the thing it did when he was running calculations faster than his training could support. "All 6 of them dropped in the last 15 minutes, he said, walking with her. "Oh, 2 SATs declining, 2 of them below 90, 1 of them's moving toward respiratory failure. Stop supplemental oxygen on anyone below 90 SAT, she said immediately. He blinked. "That's chlorine derivative inhalation causes oxidative injury to the pulmonary epithelium. High flow oxygen accelerates the tissue damage. You want nebulized sodium bicarbonate, and you want bronchodilators, not oxygen escalation." She was moving through the bays as she talked. "Where's your respiratory therapist?" "Janelle's on." "Get Janelle to all 6 patients. Nebulize bicarb, 2.5 to 5 milliliters of 4% solution, repeat every 15 minutes, monitor peak flow. The ones below 90 need to be sitting upright, not supine, not semi-reclined, upright, to maximize diaphragmatic excursion." She stopped at the first patient, a man in his 40s whose color was wrong in the specific way of someone whose lungs were working too hard. "Hi," she said to him. "I'm Mara. I know it's harder to breathe right now, and I know that's frightening. We're going to change your treatment, and you should start feeling improvement within about 20 minutes, okay?" He nodded, his breath shallow and controlled with effort. She adjusted his position herself, checked his monitoring leads, confirmed the nebulizer order with Janelle, who had appeared at her side with the quiet efficiency that had made Mara trust her from their first shift overlap. She moved through all 6 patients in 11 minutes, adjusting treatment protocols, resetting monitoring parameters, and giving Faraday a running explanation not because she needed him to understand right now, but because he was going to need to manage this without her eventually, and the knowledge had to transfer. On the 6th patient, Kessie, the 19-year-old who'd walked in under her own power, Mara paused. Kessie was sitting upright as directed, the nebulizer mask over her face, her oxygen saturation holding at 92. Her eyes were open and tracking Mara with the alert, slightly shell-shocked expression of someone who had processed enough of the last several hours to know she'd come close to something and hadn't quite reconciled that yet. She took the mask off briefly. "That lady in the suit," she started. "Focus on your breathing," Mara said gently. "She had a lot of stars on her uniform." "She did. Is she here for you?" Mara looked at her for a moment, 19 years old, second shift ever, and she'd almost died between the triage station and a hallway chair because the injury was subtle and the morning had been chaos. "Yes," Mara said. "Because you were in the army?" Because some things that should have been sorted out a long time ago are finally getting sorted out, Mara said, which was as much of the truth as she was ready to speak out loud. Kessie put the mask back on and nodded as if that made perfect sense. Mara straightened and turned to find Preston Alcott standing 10 feet behind her. He had come out of the OR. His scrub cap was still on, his gown replaced with a fresh one. He had been in surgery for the last 2 hours, and he looked it. The particular physical exhaustion of sustained operative work, hands that weren't entirely steady at rest, face that had the post-OR flatness of someone whose adrenaline was finishing its exit. He was looking at her with an expression she hadn't seen from him before. Not anger, not the careful authority he typically arranged on his face like furniture he'd decided to buy and wasn't going to move. Something more honest than that. "The 6 inhalation patients," he said. "Faraday said you changed their treatment protocols." "I did. Oxygen reduction in hypoxic patients." He said it as if testing the words. "That's counterintuitive," she said, "but correct for this specific exposure. The mechanism is different from standard hypoxia." He was quiet. Then, "Where did you learn that?" She met his eyes. "Does it matter right now?" He looked at the patients, at Kessie, at the monitoring readouts beginning to trend in the right direction. He looked at all of it with the expression of a man doing a recalculation that covered more than just the clinical question he'd asked. "No," he said finally. "I suppose it doesn't." He turned to go, then stopped. "The military personnel," he said, without turning back. "Fisk is meeting with them now. He came to find me before he went in, and he looked—" Alcott paused. He looked like someone who'd just realized they were standing on the wrong side of something. He walked away before Mara could respond. She stood in the middle of the trauma bay, the monitors beeping around her, Janelle moving efficiently between the inhalation patients, Garrett managing the remaining acute cases without prompting. The ER settling into the specific rhythm of a space that has survived its worst hours and is now doing the quieter work of holding on. Her badge was clipped to her scrub pocket. The folder was in a conference room down the hall. General Rourke was somewhere in this building, and so was Gordon Fisk. And between those two facts was a conversation that was already happening. A conversation that Mara understood, in the careful way she'd learned to understand these things, was not going to end with Fisk walking out of it the same way he'd walked in. She didn't know yet what she was going to tell Rourke about reinstatement. She hadn't had time to know. But she knew, with a certainty that didn't require the time or the processing, that the 3 years she'd spent being quiet and careful and small, the 3 years of being only what the credentialing committee could verify and nothing more, were over. One way or another, they were over. She walked to the next bay where a man she hadn't assessed yet was waiting, and she picked up his chart and she read it with her full attention because that was what the moment required. Outside, through the trauma bay windows, the smoke column over Harwick had thinned from black to gray. It would be white before evening. And somewhere 2 floors up, in the hospital administrator's office, she could already feel the ground shifting under the building. The ground shifting under the building turned out to be literal, in the way that metaphors sometimes become when reality decides to stop being subtle. It started with a call to Deb Haverford's station phone at 2:47 in the afternoon, 14 minutes after the last Harwick ambulance had come through the doors. Mara was still in the ER, still technically on shift in the informal, undocumented way that her reinstatement had happened. Badge returned. Suspension rescinded by word rather than paperwork. The administrative machinery trying to catch up with the morning's events. She was at the medication cart reviewing a chart when she heard Deb's voice change. Not what Deb said, just the register of it. That particular drop in pitch that meant the person on the other end of the line had said something that required the receiver to stop whatever they were doing and give the call their full weight. Mara looked up. Deb set the phone down and looked across the station at her. "The Harwick site," Deb said. "The fire department's structural team went in an hour ago to assess the eastern building. They found a secondary collapse in the administrative wing." A pause. "There were people in there. Workers who'd sheltered in place instead of evacuating. They've been in the rubble for almost 3 hours. Mara set the chart down. "How many?" "They're not sure yet. At least 8, possibly 12. Deb was already pulling up the incident log. 2 confirmed extraction underway, 6 still located but unrecovered. The rest, unknown. Crush injuries. 3 hours of compression. The math on that was not good. She was already thinking through it. The specific, brutal physiology of prolonged entrapment, the way muscle tissue begins breaking down under sustained compression and the toxins accumulate in the blood, waiting. The moment of extraction was often more dangerous than the entrapment itself. She'd seen it twice in the field. Once the pressure released, the potassium and myoglobin flooded the circulation simultaneously, and the heart did things that were very difficult to reverse. "Get me whoever's running the trauma floor right now," she said. Faraday appeared from Bay 3 as if summoned. He'd been on continuous since the first wave, and it showed. His face was doing the tired, resolute thing of someone who'd passed through their second wind and was running on the reserves behind it. "Crush injuries incoming," Mara said. "Prolonged entrapment, minimum 3 hours. We need to prepare for reperfusion syndrome and rhabdomyolysis as primary concerns, not the traumatic injuries from the collapse itself. Whatever cardiac monitoring we have, pull it to the trauma bay. I need IV access in every incoming patient before the pressure is released at the site. Ideally, we're in contact with the extraction team and they're hydrating patients while they're still in the rubble." Faraday blinked. "We can do IV access in an active rescue site? If the fire department has a paramedic on the extraction team and the access point is viable, yes. It's not standard here, I know. Call the incident commander at the Harwick site. His number should be on the emergency coordination sheet. And ask specifically if there's a medic embedded with the extraction crew. If there is, get them on the phone with me." "Right now?" "Right now, yes." He went. She turned to Deb. "What's our IV fluid capacity?" "We burned through a lot this morning." "Tell me what we actually have." Deb checked. "Maybe 60 liters of normal saline. Lactated Ringers is lower, maybe 30. Get pharmacy on the phone and find out what they can move down here in the next 30 minutes. For crush syndrome, we want Ringers over saline for the alkalinization benefit, but we'll use what we have." She paused, running the rest of the protocol through her mental checklist. Sodium bicarbonate drips. Same calculation, whatever we have. Potassium monitoring every 30 minutes on each patient minimum. And we need a nephrologist on standby. Some of these patients are going to go into acute renal failure, and they're going to need dialysis capability before tonight. Deb started making calls. General Rourke appeared at the trauma bay entrance. She'd changed out of her dress uniform. She was in operational clothes now, the quiet, unmarked kind, which told Mara that she kept a bag somewhere that anticipated exactly this kind of transition. She looked at the activity level in the ER, at Mara's face, and calculated quickly. "What do you need?" Rourke said. Mara looked at her. "Can any of your team provide medical support at the extraction site?" Rourke turned to the man at her shoulder. Not Vance, one of the others, a woman in her 30s whose name Mara still didn't have. The woman gave a single nod. "Sergeant Osei has trauma medic qualification," Rourke said. "I need her at the Harwick site with IV access capability and a radio channel to this bay," Mara said. "If she can establish IV lines on patients while they're still in compression and run aggressive fluid resuscitation before extraction, we reduce the reperfusion cascade significantly." Rourke looked at the woman. "Osei." Osei was already reaching for her phone. "Give me the incident commander's frequency," she said, and it wasn't a question. Mara didn't have it yet, but Faraday was crossing the room toward her with a name and a number on a piece of paper, and she handed it directly to Osei, and Osei was talking before she'd fully turned away from the desk. That was how the next phase started. Not with ceremony, not with any official structure that anyone had planned, but with a series of individual decisions made in rapid succession by people who could see what was needed and move toward it. Preston Alcott came out of a surgical consult at 3:15 and found his ER running a hybrid military-civilian trauma operation that nobody had approved and that he did not have the authority to stop, nor, and she could see him arriving at this conclusion in real time, any desire to. He stood at the periphery for approximately 90 seconds. Then he scrubbed back in and took the first crush injury patient that came through the door. He did not ask Mara's permission. But when he had a question about the potassium monitoring protocol, a genuine clinical question, not a challenge, he asked her directly, and she answered directly, and they moved on. It was the most functional they had ever been with each other. The first two extraction patients arrived within 20 minutes of each other. Both had received pre-extraction IV fluid resuscitation from Sergeant Osei at the site. Mara could see the field lines, improvised but competent, and she didn't comment on the technique because the outcome was what mattered. Their potassium levels were elevated but not critical. Their kidneys were stressed but not failing. She managed both cases with the focused, procedural efficiency of someone working a problem they knew, and the nephrologist she'd requested, a Dr. Waverly, reached by phone in her office upstairs and persuaded to come down by the specificity of Mara's concern, arrived in time to consult on the second patient before things got complicated. The third patient was the one that complicated things. His name was Eddie Garza. He was 44 years old, a floor supervisor at Harwick, and he had been in the rubble for 3 hours and 27 minutes. Osei's radio call had flagged him as the most critical of the extracted patients. He'd been partially conscious on arrival at the rubble site, but had declined during the extraction process itself, and his field IV had infiltrated, which meant he'd received less than a third of the intended pre-extraction fluid volume. He arrived in full cardiac arrest. The paramedics were doing CPR. The monitor showed a rhythm Mara recognized immediately: coarse ventricular fibrillation, the kind associated with severe hyperkalemia. His potassium, when they got the first draw, came back at 8.1 milliequivalents per liter. Normal range topped out at 5.0. At 8.1, the heart's electrical system was running on borrowed time, and the standard ACLS approach to VFib, repeated defibrillation, epinephrine, was not going to work until the underlying electrolyte crisis was addressed. "Stop compressions," she said. The paramedic looked up. "He's in VFib." "I know. Defibrillation won't convert him at this potassium level. We need calcium gluconate first to stabilize the cardiac membrane." She was already reaching for the medication tray. "Get me 10 milliliters of 10% calcium gluconate Osto IV push. Now. Then sodium bicarbonate 50 milliequivalents IV push behind it. We defibrillate after the membrane is stabilized, not before." The paramedic hesitated. Not out of disagreement, she thought, but out of the specific paralysis of someone watching a protocol they'd never seen before, delivered with complete authority. Alcott was at her side. He looked at the potassium number on the readout. He looked at her. "Do it," he said to the paramedic. The calcium went in, the bicarb behind it, 40 seconds. The rhythm on the monitor shifted, the coarse fibrillation organizing itself, not to sinus, but to a shockable rhythm with more internal coherence. It was a small change on a readout screen. It was also the difference between a shock that would work and a shock that wouldn't. "Now," Mara said. The defibrillator charged, the shock delivered. The monitor flatlined for 3 seconds. Then a beat. Irregular, but a beat. Another. A third. Slowly, grudgingly, like something that had decided to come back not because it was ready, but because it had been argued into it, Eddie Garza's heart found a rhythm. Nobody in the bay made a sound for about 4 seconds. Then Alcott exhaled. Not theatrically, just the involuntary release of someone who'd been holding their breath without realizing it. "Nice," he said. One word, but he said it looking at Mara. She didn't acknowledge it. She was already assessing Eddie's response, recalculating the next 20 minutes of management. He needs continuous cardiac monitoring and repeat electrolytes every 15 minutes. We need to bring his potassium down gradually. Insulin and dextrose infusion. Not too aggressive. We don't want to overshoot. Waverly needs to be at the bedside. Waverly, who had been watching from the foot of the bay, moved forward without being asked. It took until 4:30 before the last of the extraction patients had come through and been stabilized or sent upstairs. The ER settled into the aftermath rhythm. Quieter, but not quiet. The difference between a storm and the hour after, when the damage becomes visible and the work of assessment begins. Mara was at the sink, hands under running water, looking at the drain without really seeing it. Her feet hurt. Her lower back had the deep, specific ache of someone who had been on a trauma floor for 7 straight hours without sitting down. She was aware of these things the way she'd always been aware of physical discomfort during sustained operations, as data, present but not primary, queued behind everything else. Vance found her there. He came up beside her and leaned against the counter with the deliberate patience of someone who understood the value of not rushing a moment. "Fisk is in federal custody," he said. She turned off the water. "When?" 2 hours ago. We executed the arrest warrant when he was in the meeting with General Rourke. He said it without satisfaction, just information. He cooperated with the process, didn't make a scene. A pause. "I think he saw it coming." She thought about the badge in his jacket pocket, the preloaded gesture of reinstatement. A man who had been covering his tracks for 4 years would know how to read a room when the room started reading back. "What about the Meridian connection?" she said. "That's a longer process. The holding company structure requires more documentation to unwind, and there are other hospitals in the network. We're coordinating with state health departments in 4 states. He looked at the floor for a moment. The Ruth Kavanaugh case and 2 others are being referred to the state medical board for review. The hospital's supply chain is being audited as of this afternoon. Ruth Kavanaugh, with her 11 hospital days and her reduced kidney function that her family had been told was an unfortunate complication. She was somewhere out there, living with a consequence that had a name now, and a cause, and a set of people responsible for it. "Will she know?" Mara asked. "The patient from the supply chain audit. Will she be told?" "That's above my authority," Vance said. "But the investigation is public record once charges are filed. She'll have the ability to pursue civil remedies." It wasn't the answer she wanted, but it was the honest one, and she'd rather have that than a reassurance that dissolved in the daylight. "What happens to Alcott?" she said. Vance considered the question. "Alcott wasn't part of the Meridian scheme as far as we can determine. He's clean on the fraud side." He paused. "What he is or isn't responsible for professionally is a question for the medical board. That's not my investigation." She nodded once. She went to find Rourke. The general was in the conference room where they'd started, the folder still on the table, now with additional documents around it that hadn't been there before. Osei was back. She'd returned from the extraction site with grease on her jacket and a small laceration on her left forearm that she had treated herself and clearly considered not worth mentioning. Vance's partner was on a call in the corner, voice low. Mara sat down across from Rourke. "Fisk is in custody," she said. "Yes." Rourke had known before Mara did, obviously. She was watching Mara with the same careful attention from earlier. "How are you doing?" "I'm tired," Mara said, because it was true and because she was past the point of performing otherwise. Rourke nodded. "That's a reasonable response to today." "I want to know about my court-martial." She'd been building toward this since the lobby. Not angrily. She was too tired for the kind of anger that needed an audience. But with the specific gravity of someone who had carried a question for 3 years and was ready to put it down properly, not just have it taken away. Not the general version, the specific version, what Sloan fabricated, what the witnesses said, what the actual record shows. Rourke was quiet for a moment. Then she reached into the folder and pulled out a document. Not the Meridian material, something else. Something with military classification headers that had been administratively declassified in the last week, the date stamp visible in the upper right corner. She slid it across the table. Mara looked at it without touching it first. "The Corrigan mission," Rourke said. "You reported a supply discrepancy, specifically a medical equipment shipment that listed 14 units of surgical hemostatic material but received 6. You filed the report through the quartermaster chain." "I remember." Sloan intercepted the report before it reached the QM inspector. He replaced it with a corrected version that described a clerical error, resolved. He then arranged for the remaining 8 units to be diverted to a Meridian-affiliated distributor operating under DoD contract. The value of those 8 units in the secondary market was approximately $40,000. Rourke said it the way she said everything, flatly, without editorializing, letting the information carry its own weight. When you continued asking questions about the discrepancy through informal channels, conversations with your team, questions to the supply officer, Sloan decided you were a risk. She already knew this part, broadly. But hearing it in the specific made it different. The staging area incident, Mara said. 2 witnesses testified that you had failed to secure the medical storage unit prior to the advance operation, resulting in loss of critical supplies. Rourke's voice didn't change. The storage unit was breached by Sloan's personnel 12 hours before the operation. Both witnesses were members of Sloan's unit. One of them has since provided a sworn statement to NCIS. The other was approached 6 months ago and initially declined to cooperate. A pause. He reconsidered 3 weeks ago. Mara looked at the document. She had spent 3 years knowing the truth and not being able to say it in any room where it mattered. She had built a life around the discipline of not saying it, around the understanding that the truth, when it isn't documented, isn't provable. And when it isn't provable, it can cost you more to speak it than to carry it. The document in front of her was the truth in a form that mattered. 42 pages of it. She touched the edge of it. Then she pulled it toward her and read it. Not skimming, not scanning, but reading it the way she'd read the Meridian folder earlier, with the same meticulous attention to the middle pages. It took her 23 minutes. When she finished, she set it down and looked at the table for a moment. "There's a personnel action attached," Rourke said, "at the back." She turned to the last few pages. The official reinstatement documentation. Her name, her service number, the formal reversal of the separation under other than honorable conditions, the restoration of rank. Behind it, a set of orders she hadn't expected. Reinstatement of her medical commendations, including one she'd been awarded before Sloan's investigation had begun, and that had been administratively suppressed when her record was being constructed against her. And behind those, a citation she'd never seen before, dated 18 months ago, signed by a general she didn't know, citing a specific action from the Corrigan operation that had apparently been documented somewhere outside Sloan's reach. A medic's decision to reroute a casualty evacuation under fire that had saved 4 lives. The kind of decision that happened too fast for deliberation and too quietly for ceremony. Someone had written it up anyway. Someone had kept it. She looked at Rourke. "Who filed this?" she said. "Your team medic, Specialist Okafor." Rourke said it carefully. "He filed it the week after you were separated. He knew what had happened, and he knew he couldn't stop the court-martial from a specialist's position, but he filed the citation anyway and kept a copy outside the standard records system." A brief pause. "He works for Vance now, actually. He's been part of the task force team for 8 months. Mara sat with that for a moment. A specialist who had watched her be blamed for something Sloan had engineered and had done the one thing available to him, documented the truth in a form that might survive. 8 months on a task force he'd probably taken specifically because it might lead here. Some forms of loyalty were very quiet and very long. She closed the document. "I need to answer your question," she said, "about reinstatement." Rourke waited. "I'm not ready to answer it tonight," Mara said. "I know that's not—" "It's fine," Rourke said. "It's a significant decision, and you've had a significant day. I need to understand what it means for the work I'm doing here." She gestured, generally, at the hospital around them. The direction of the trauma bay, the floor above, the patients who were alive because of the morning's work, and also because of the compromised materials that had been killing people slowly and which were now being audited because of a task force that had known where she was for 6 months. "I'm not going to make a decision about my future that treats the last 14 months as irrelevant." "Nobody is asking you to," Rourke said. "I want it in writing. Whatever I decide, the record clearance happens regardless, and it's documented in a form I can access without military authorization." "Already prepared," Vance said from the doorway. She hadn't heard him come back. He held up a document. "Civilian copy, notarized, admissible in any federal or state proceeding." He set it on the table beside the other papers. "That one's yours to keep. It doesn't depend on any decision you make." She looked at the 2 documents side by side. One that gave her her name back, one that left the future open. Then her radio. Deb had given her a hospital radio at some point in the afternoon, clipped to her pocket, crackled. "Mara," Deb's voice. Flat in a specific way that Mara had learned in 14 months, meant that Deb was controlling her tone deliberately. "I need you in the ER Bay 2. "What is it?" "It's Dr. Alcott." A pause that carried something in it. "He's the patient." She was on her feet before the sentence finished. The corridor between the conference room and the ER was 43 seconds at a walk, and she did not walk. The trauma bay doors opened and she went through them and found Bay 2 with the curtain half drawn, and Garrett inside with a cardiac monitor going and Priya on the other side running an IV line. Alcott was on the gurney. He was conscious. That was the first thing she registered, and the relief of it was involuntary and surprised her. He was sitting up against the backrest, which was a better sign than he might have presented, and his color was bad, but not the specific bad she dreaded crossing the floor toward. His left arm was out for the IV. The monitor showed sinus rhythm with some irregularity that she classified in under 2 seconds as bigeminy, alternating normal and premature beats, uncomfortable, significant, but not immediately life-threatening. He looked at her when she came in. "This is embarrassing," he said. His voice was rougher than usual. "Tell me your symptoms," she said. "Chest tightness started about 20 minutes ago. I thought I was tired." He shifted, which made Garrett and Priya both tense. "I'm aware of what the monitor shows." "Good. Then you know you need to stop moving." She pulled up his IV and checked the line. "How long has the bigeminy been present?" Garrett said about 4 minutes from when he hooked up the monitor. "Chest pain now?" "Pressure. 3 out of 10. "Radiation? Arm, jaw, back?" "Left arm. Minor." A pause. "Which I know is not minor." "No, it's not." She was running through the differential, stress-induced demand ischemia from a sustained high-output day in the OR, underlying coronary disease that had been compensated until today's volume broke its tolerance, or something more acute. "Has cardiology seen you?" "I told Garrett to call you first." She looked at him. "You should have told him to call cardiology first," she said. "I know." He said it without defensiveness, just a flat acknowledgement. "But I wanted—" He stopped. "I wanted someone in the room who would tell me what was actually happening." She held his gaze for a moment. "I'll tell you what's happening," she said. "You've been in surgery or on your feet for approximately 9 hours. Your heart is running a compensation pattern that means it's been under sustained stress, and something is irritating the electrical conduction. Whether that's demand ischemia or something more structural, we don't know yet. You need an EKG in the next 5 minutes, troponin levels at 0 in 3 hours, and you need cardiology to decide whether you're going upstairs tonight or being admitted for monitoring." She paused. "That's what's actually happening." He nodded once. The monitor beeped its irregular pattern. "I was wrong about you," he said. "From the beginning." It was the quietest room she'd been in all day. "I know," she said. Yes. That's fair." He looked at the monitor. "The boy. Danny Kowalski. He's on 4, recovering well." You knew before anyone with the credentials to know went in and confirmed it." She didn't answer, because it wasn't a question. "Where did you actually train?" he said. She looked at him on the gurney, the monitor blinking its irregular rhythm, the IV line running fluid into his arm. The man who had signed her suspension paperwork this morning, now lying in the bay where she'd managed 2 cardiac cases before noon. She opened her mouth to answer. The doors to the trauma bay burst open. Not paramedics this time, not hospital staff. 2 men in federal law enforcement credentials, followed by a third in a state police uniform, and behind them, moving with the specific controlled urgency of someone delivering news that cannot wait for a better moment, Special Agent Vance. He was looking directly at Mara. "We have a problem," he said. "One of the Meridian executives was notified about Fisk's arrest. We don't know the source yet. He's been attempting to access and destroy records in the last 90 minutes. He paused. "The records include documentation tied to your court-martial. Specifically, communications between the Meridian legal team and Colonel Sloan's defense counsel during your proceedings." His voice was steady but tight. "If those records are destroyed, the link between the civil fraud and what happened to you militarily becomes significantly harder to establish." The trauma bay was very quiet around them. Mara looked at Vance. "What do you need?" she said. "There's a server location, physical hardware. We need someone who can identify the relevant files if the metadata has been altered or encrypted. Someone who was present during the Corrigan investigation and knows the specific documentation that was created." He held her eyes. You're the only person still alive outside Sloane's direct network who was in those rooms. Behind her, the monitor beeped. Alcott's bigemony continued its unsteady rhythm. Priya was standing at the bay entrance, looking at Mara with an expression that was trying to be professional and not entirely managing it. "Garrett," Mara said, without turning around. "Yeah?" "Call cardiology. Right now. Tell them we have a surgical attending in bigemony with chest pressure and probable demand ischemia after a 9-hour operative day. I need someone down here in the next 10 minutes. She finally turned. "Don't leave this bay." "I won't," Garrett said. She looked at Alcott one more time. He was watching her with the expression of someone who had spent the morning trying to remove her from the building and the afternoon watching what that would have cost, and was now, finally, too late in the day, in the wrong direction of a cardiac event, beginning to understand the full shape of what he'd been looking at for 14 months without seeing. "Go," he said. "I'll be here." She followed Vance through the doors. The state police officer was already on his radio. The two federal agents were moving toward the exit, and the evening light was coming through the lobby windows in long, low angles that turned the linoleum gold, and the hospital around her was a different building than the one she'd walked out of at 9 this morning. The same floors, the same walls, but everything underneath them rearranged. She didn't know yet what was on the server. She didn't know if the records were intact or partially destroyed, or whether the communication between Meridian's legal team and Sloane's defense counsel would be recoverable in a form that could close the last gap in the case against the people who had taken 3 years of her life. What she knew was that she was the one who could find out. Vance held the door. She walked through it into the evening air, and the ground under her feet was solid, and the building behind her was still standing, and somewhere inside it, Alcott's heart was beating its imperfect rhythm in a bay where she had once watched a man come back from 8.1 milliequivalents of potassium and a flatline that lasted 3 seconds. The state police cruiser was running at the curb. She got in. The cruiser pulled out of the Ravenwood General parking lot at 5:12 in the afternoon, and Mara sat in the back seat with Vance beside her and watched the hospital shrink in the rear window until the road curved and it disappeared behind a stand of cottonwood trees that were just beginning to turn. She was still in her scrubs. She had not eaten since the granola bar she'd had at 6 that morning, 3 hours before any of this started. She was aware of both facts the way she was aware of her aching feet, as data, present but not primary. "Tell me about the executive," she said. Vance had his phone out, running something on the screen she couldn't read from the angle. "His name is Trent Holloway, Meridian's chief operations officer. He's been with the company for 9 years, and he's been the primary architect of the supply chain diversion structure, the one that connected DoD procurement to the hospital contracts." He looked up. He found out about Fisk's arrest from someone inside the Drapers Crossing PD. "We don't have a name yet for the leak, but we're working on it." "How much time has he had?" 90 minutes before we knew he was moving, maybe 2 hours total. He said it with the flat, controlled frustration of someone accounting for a failure without dramatizing it. The server location is a commercial data facility on the east side of Drapers Crossing, a leased rack space under a shell company name. Our digital forensics team is en route, but they're 40 minutes out from Denver. We need someone who can physically identify the relevant hardware and document the file structure before Holloway or his people get there and before anything else gets wiped. "You think he's going in person?" "He's already there. We have a visual confirmation from the facility's external camera. He entered 23 minutes ago with a laptop bag and a key card." The driver accelerated. Outside, the Wyoming evening was doing what Wyoming evenings did in October, going golden and cold simultaneously, the light long and honest and indifferent to the events of the day. "What exactly am I identifying?" she said. "The Corrigan file structure. The communications between Meridian's legal team and Colonel Sloane's defense counsel were transmitted through an encrypted internal server that Meridian used for sensitive client correspondence. The metadata was wiped during the court-martial proceedings. That's why the digital trail went cold. But the original file naming convention used a project code that was specific to Sloane's operation, and the physical backup of those communications was made because Meridian's legal team was protecting itself. They wanted documentation that Sloane had requested the suppression, not them." He paused. "If those backups are intact, we have direct evidence that Sloane commissioned the fabrication of witness testimony and that Meridian facilitated it. If Holloway destroys that hardware tonight, we can still prosecute the fraud case, But the connection to your court-martial becomes circumstantial. Circumstantial. 3 years of her life, a court-martial on a fabricated record, and the difference between provable and circumstantial was a physical server rack in a commercial data facility in Draper's Crossing that a man named Trent Holloway was currently trying to destroy. The project code, she said. What was it? Osprey 7. We found the reference in a recovered email from one of Sloan's logistics officers. It's the only external reference we've located. She hadn't heard that designation during the Corrigan investigation. But she knew how Sloan operated. Teague compartmentalized, deliberately obscuring the chain. He wouldn't have used a code his own personnel recognized. It would have been created externally for the external relationship. What was the naming convention for my file during the court-martial proceedings? She said. Vance looked at her. My case file, the JAG designation. Solus M/case 2271. She looked at the passing road. Then look for a folder or file that cross-references Osprey 7 with Solus or 2271. That's where the connection will be if it exists. Legal teams don't maintain operational security the way field units do. They organize by client and case. They'd have referenced the subject by name or case number even in a sensitive file. Vance was already typing. That's useful, he said. I know how to read a procurement trail, she said. That's what started all of this. He nodded and didn't say anything else, which was the right response. The data facility was a nondescript commercial building in an industrial park on the eastern edge of the city. The kind of architecture that communicated function and nothing else. Gray cladding, minimal signage. The only distinguishing feature a keycard access panel at the main entrance and a security camera that Vance's team had already flagged was still transmitting. A state police unit was already in the parking lot when they arrived, positioned at the far end in a way that covered the exits without being immediately visible from the entrance. Vance was out of the cruiser before it fully stopped. Mara followed. The facility manager, a heavy-set man in his 50s named Walt, who had the resigned expression of someone whose evening had not gone the way he'd planned, was waiting at the entrance with a building security officer and a federal agent Mara didn't recognize. He's in rack room C, Walt said. He badged in with a valid credential. The lease is current under the shell company. We didn't have grounds to stop him when he came in. He was looking at Vance in the specific way of someone who needed to know that they had not done anything wrong. I called you as soon as the camera flagged the alert from your system. You did right, Vance said. Does he know we're here? There's no interior camera in the rack rooms. Tenant privacy. Walt's expression said he now had opinions about that policy. He could have a cell signal in there, depending on the hardware density. Some of those rooms block pretty well, some don't. We go in now, Vance said. Walt badged them through. The interior of the facility was cold the way server environments always were. The ambient chill of cooling systems running continuously, the low hum of hardware, the specific smell of circulated filtered air that Mara associated with the kind of precision infrastructure that looked unremarkable and held enormous amounts of information. The corridor to Rack Room C was narrow and fluorescent lit, the kind of hallway that existed purely for access, not for comfort. Vance stopped at the door. He looked at Mara. Stay behind me until I clear the room, he said. Not a request. She nodded. He opened the door. Trent Holloway was 41 years old, and he looked, in this moment, nothing like the professional headshot that Vance had shown her in the cruiser. A composed, well-dressed man in his mid-career, the kind of person whose LinkedIn described him as a visionary in healthcare logistics. He was standing in front of an open server rack, a laptop balanced on a rolling cart beside him, a cable running from the laptop to a port on the rack. He had his jacket off and his sleeves rolled up, and he was doing something on the laptop keyboard with the specific, focused urgency of someone who has decided that speed matters more than precision. He looked up when the door opened. He did the calculation very fast. Vance, the federal credentials, the two other agents in the doorway, Mara behind them in hospital scrubs. And his face went through a controlled sequence of responses that ended somewhere that wasn't quite resignation, but was adjacent to it. The face of someone who had prepared for this possibility and was now executing the version of events he'd planned for it. I have a valid lease, he said. I'm accessing my company's property. You're accessing hardware associated with a federal investigation under an obstruction warrant, Vance said. Step away from the rack. Holloway didn't move immediately. His eyes went to the laptop screen for half a second, a reflex, not a decision. And in that half second, Mara looked at the rack behind him and read the unit labels. She had spent years reviewing supply chain documentation. She knew how enterprise data systems organize physical infrastructure, the label conventions, the rack unit numbering, the way backup systems were tiered. The rack in front of Holloway had 12 units. 3 of them had indicator lights that were running differently from the others. Active read-write state, not idle. He'd been pulling files, not deleting, or he'd been copying. Copying was worse than deleting, in a specific way that mattered. He's not wiping, she said quietly from behind Vance. He's copying. The read-write indicators on units 4, 7, and 11 are active. He's transferring, not erasing. Vance registered this without changing his expression. To Holloway, step away from the rack now. Holloway stepped back. One of the agents moved to the laptop and physically disconnected the cable from the rack port. Another moved to the rack itself. Holloway looked at Mara. It was the look of someone identifying, for the first time, which piece had changed the board. "You're the nurse," he said. She didn't answer. "You're the one Fisk suspended." He said it like he was working something out. "You weren't supposed to be—" He stopped. "Weren't supposed to be what?" Vance said. Holloway closed his mouth. He had a lawyer somewhere, probably already called, probably already in a car. He knew the rules of the next stage of this, but the sentence hung in the room anyway. You weren't supposed to be. And everyone present understood what the end of it was. She wasn't supposed to be there. She wasn't supposed to be in the building. The suspension that morning, the badge removed, the security escort to the parking lot, it had been designed to look like an internal hospital dispute about a difficult nurse who didn't follow authority. But Holloway had said Fisk, and Fisk had known about the investigation for longer than the last 90 minutes, which meant the suspension had been something else, something more deliberate. She felt it settle over her with the cold clarity of a thing finally named. They'd known about Rourke's task force. Not everything, not the specifics, not the NCIS angle, but someone had told someone that there was federal interest in Meridian's hospital contracts, and Fisk had moved to remove the one person in the building who might be able to connect the supply chain irregularities to their source. The nurse who asked too many questions, the nurse with the unexplained employment gap, and the clinical instincts that didn't match her documented training. They hadn't known who she was, but they'd known she was a problem. She stood in the cold rack room and looked at Trent Holloway and felt nothing particularly dramatic, just the flat, factual weight of understanding how the morning had actually started. "Take him out," Vance said. The agents moved Holloway toward the door. He went without resistance, which was the behavior of a man who had already shifted his strategy to the next phase. Vance stood next to Mara in front of the server rack. "Units 4, 7, and 11, she said. "Yeah." He was looking at them, at the active indicators. He was moving copies, not destroying originals, which means the originals are still here. He pulled out his phone. "I need to get our forensics team on the phone. They can walk us through securing the hardware without compromising the chain of custody. The file I described, Osprey 7, cross-reference to Solace or 2271. If it's here, they'll find it." He was already dialing. She stepped back and leaned against the wall of the rack room and let the cold and the hum of the infrastructure settle around her. She was running on the last of whatever reserve she'd been using since approximately noon, and her body was beginning to present its bill. She thought about Alcott in Bay 2, the cardiac monitor running its Bigemini pattern. She thought about Garrett, who she'd told not to leave that bay. She thought about Kessie in her hospital gown with her rebuilt lung pressure and her question about the lady with the stars. She thought about Ruth Kavanaugh with her 11 days and her damaged kidneys, and the thing she'd been told was an unfortunate complication. The forensics team from Denver arrived 38 minutes later, which was faster than Vance had estimated, and which suggested they'd been moving before the call. They were 2 people, a woman and a man, both in civilian clothes, both carrying equipment cases that they unpacked with the efficiency of people who did this in less cooperative environments and found a commercial data facility refreshingly straightforward. Mara watched them work from the doorway for 20 minutes. Then Vance came and found her and told her she could go back to the hospital if she needed to, that the forensics process from here would take hours and didn't require her identification anymore. "Did you find it?" she said. He looked at her for a moment. "We found a file structure consistent with what you described. The forensics team is verifying integrity now. I can't tell you it's confirmed until they clear it." "But you found the structure." "We found the structure," he said. She drove herself back in the state cruiser that had been offered and which she accepted without ceremony, sitting in the back alone while the driver navigated the 20 minutes to the hospital in the October dark. She didn't think about the server. She didn't think about Holloway or Sloan or the 4 years of a fraud case that was now in the hands of people who were better equipped than her to finish it. She thought about the morning, the specific sequence of it, the badge surrendered, the parking lot, the pressure wave she'd felt in her chest before she heard it, the decision to put the car in reverse. She hadn't done it because of the task force or the server or 3 years of buried truth. She'd done it because she'd calculated what was coming and she'd been the most qualified person available, and the alternative was worse. That was still true. It had been true every time. Ravenwood General came back into view as the cruiser turned off the main road, its lit windows visible across the parking lot. She went in through the main entrance. The lobby was quiet in the way of hospitals after a mass casualty event. A specific kind of quiet that wasn't empty, just wrung out. The families in the waiting area sitting with the exhausted relief of people who had received news that was survivable. A volunteer was moving between them with water and small assurances. She went up to 4 first. Danny Kowalski's room was lit softly, the door open. He was awake, which surprised her. His mother, a woman in her 40s with the same wide, dark eyes as her son, was in the chair beside the bed, and they were both watching something on a tablet propped on the rolling tray. Danny saw Mara in the doorway and raised a hand in a small wave. She stepped in. "How are you feeling?" "My head hurts," he said. "That's expected. It'll get better." She looked at the monitor readings above his bed. Stable, good, better than she'd hoped when she'd been standing at his bedside that morning arguing with a chart. "You gave everyone a scare." "My mom cried," he said, with the particular combination of sympathy and embarrassment that was specific to 14-year-old boys whose mothers had cried. "I did cry," his mother said, without any trace of apology. She looked at Mara. "They told me, the neurologist. He told me that a nurse caught something the overnight team missed." She paused. "Was that you?" "I flagged a concern," Mara said. "The neurologist made the call." Danny's mother looked at her with the steady attention of someone who had spent the day in a waiting room processing what had almost happened and had developed very clear opinions about what she wanted to say to the right person when she found them. "Thank you," she said. It was 2 words, plainly delivered. Mara stood with them for a moment. "Get some sleep," she told Danny. "Both of you." She went back down to 2. Alcott's bay had been upgraded. He'd been moved to a proper room on the cardiac floor, which meant cardiology had seen him and made a decision, which was a good sign. She found him in room 214, an IV still running, the monitor beside his bed now showing a rhythm that had stabilized out of bigeminy into something closer to normal sinus. He looked smaller in the hospital gown than he looked in scrubs, which was not an observation she made with satisfaction, just an observation. He was awake. A tablet on his tray had case files on it, which she chose not to comment on. "Troponin?" she asked. "Mildly elevated, not diagnostic for STEMI. They think it's demand ischemia, like you said." He said it with the flatness of a clinician receiving a clinical report about himself, which she recognized as the specific emotional mechanism that physicians used when they became patients. "They want me here tonight, stress echo in the morning." "That's the right call." "I know it is." He looked at the window. The federal agents were here earlier asking about Fisk and the supply contracts. "What did you tell them?" "Everything I know, which isn't much." He turned back to her. "I wasn't involved. I want to say that directly." "I know you weren't," she said. "How do you know?" "Because the structure was designed to keep the physicians uninvolved. It protected the scheme. If doctors started questioning material quality, the whole thing unraveled." He was quiet. Then, Ruth Kavanaugh. She looked at him. I reviewed her file this afternoon, after the federal agents asked about the supply chain audit dates, he said. Her infection, the suture batch. He stopped. I performed that surgery. The room was very quiet. You didn't know, Mara said. I didn't know. He said it with the particular weight of someone for whom not knowing was its own kind of thing to carry. She trusted me to use materials that were safe, and I... He stopped again. I didn't know. No, she said. You didn't. The culpability structure was designed exactly for that. She paused. But she'll have the right to know what happened now. Whatever comes from that, that's what should come from it. He nodded. It wasn't absolution. It wasn't designed to be. The woman in the uniform, he said. Rourke. Brigadier General Rourke, yes. She's here for you. A statement. She is. What did they do to you? He asked it directly without framing it as an expression of sympathy first, which was how he asked everything. Stripped of preamble, just the question. It was, she thought, probably his better quality. The thing that made him a functional surgeon, even when it made him a difficult colleague. She looked at the monitor. His heart rate was 68. Steady. They framed me for an operational failure, she said. In a military context, it ended my service and my record. She said it without inflation. The people who did it were connected to the same fraud network as Fisk and Meridian. That's why Rourke is here. He absorbed this. And the suspension this morning, he said. The complaint I supported. She didn't answer immediately. Fisk received a heads up that there was federal interest in Meridian's hospital contracts, she said. He moved to remove the most unpredictable variable in the building. That was me. She paused. You gave him the justification he needed, the underlying complaint about my conduct. That was real, from your perspective. He used it. Alcott looked at the ceiling for a long moment. I was wrong about you, he said. You said that earlier. I know. I'm saying it again because it needs more weight than one saying. She looked at him. He was a difficult man. She expected he would remain a difficult man, that the events of this day would change specific things about how he understood her, and possibly about how he operated in his department, but that the essential architecture of his arrogance would reconstruct itself in time, because that was how personality worked. She held no particular illusions about dramatic transformation, but he was a difficult man who had told his nurse to call her instead of cardiology because he wanted someone in the room who would tell him the truth. There was something in that worth acknowledging, even without romanticizing it. Get some rest, she said. Stress echo in the morning, no case files tonight. He looked at the tablet. I'm not making a request, she said. He closed the tablet. She went back to the ER. The night shift had taken over, which was Deb's domain, and Deb had the specific organized energy of someone running a stabilized post-event floor. The acute crises managed, the ongoing cases monitored, the staff cycling through the particular tired competence of people who had done something hard and were now doing the necessary work of maintaining what they'd built. Priya was at the medication station, doing end-of-shift charting. She looked up when Mara came in. The 6 inhalation cases, Mara said. All 6 trending positive. Kessie's O2 sat is 97. She's been asking if she can have her phone back. Priya paused. Teresa Okafor is out of surgery. Ortho stabilized the pelvis. She's in recovery. Eddie Garza is in the cardiac ICU, conscious, talking. A pause. His wife got here about an hour ago. Mara stood in the entrance to the ER and looked at the bays. The cleaned surfaces, the restocked supplies, the monitors running their steady data on the patients who remained. 50-some people who had been in the rubble or the blast radius or the smoke this morning and who were here now instead of the alternative. Thank you, she said to Priya. Priya looked at her, slightly surprised the way people were when Mara said things like that, because she didn't say them often or reflexively. Then she nodded once and went back to her charting. Mara found an empty chair at the nursing station and sat down. She pulled up the shift notes on the terminal and began reviewing the overnight patient status for the cases she'd managed. It was not her shift. She had no formal obligation to be here. She was doing it because the cases were hers in the way that her cases always became hers. Not by assignment, but by the particular form of investment that she'd never been able to stop once it started. She was 40 minutes into the review when Vance called. She stepped into the corridor to take it. "The forensics team cleared the file structure," he said, without preamble. "Osprey 7, cross-reference to Solus M and case number 2271 in the Meridian Legal Archive backup." A pause. "The communications are intact, email threads, document attachments. A memo from Meridian's general counsel to the attorney on record in your court-martial proceeding dated 4 days before the witness testimony was delivered." He stopped. She waited. "The memo is a direct record of Sloane's instruction to Meridian's legal team," he said. Verbatim, it says, "Colonel Sloane requests confirmation that the witness coordination discussed in the 14th is finalized, and that no record of this communication will be retained in the primary file. The response, in the archive, is a read receipt and a single word." He paused again. "Confirmed." She was in a hospital corridor in Wyoming, in her scrubs, with a granola bar's worth of fuel in her body and 7 hours of mass casualty trauma management behind her, and she was holding a phone to her ear while a federal agent read her a memo that proved, in documentary form, that what had happened to her had been deliberate and orchestrated and signed off on by people who had thought it would stay buried. "Okay," she said. The word was not adequate, but it was what she had. "We're filing the additional charges against Sloane tomorrow morning," Vance said. "Obstruction of military justice, witness tampering, conspiracy. The DOJ attorney has been briefed. This goes to a federal grand jury within 30 days. And Holloway. Obstruction charge for tonight, on top of the existing fraud counts. His attorney called 45 minutes ago and used the word cooperation, which is a signal. If he cooperates, the government gets the rest of the Meridian network faster. If he doesn't, we build it the slow way." He said it without particular preference. "Either way, the case against Sloane doesn't depend on Holloway's cooperation anymore. We have the documentation." She leaned against the corridor wall. Down the hall, she could hear the quiet sounds of the overnight ER. A monitor beeping, a door opening, someone calling for a colleague in the measured, unhurried tone of a non-urgent request. "Vance," she said. "Yeah." "The leak. From the Drapers Crossing PD. Whoever told Holloway about Fisk's arrest." "We're running it," he said. "It's a separate thread." If Holloway received a heads up from inside local law enforcement, then the network has local reach beyond Fisk. She said it carefully, working through it. Which means Fisk's connection to Meridian wasn't just a supply contract relationship. He was embedded enough in the arrangement that local contacts were being used to protect it. A pause on the line. "That's a line of thinking our team has also arrived at," Vance said, "in the last 2 hours." "How wide does this go?" Another pause, this one longer. "We're still determining that," he said, "which is why I'd ask you not to. There are aspects of this investigation that are still active in ways I can't discuss yet." She pushed off the wall and turned to face the corridor. The night shift nurse at the end of the hall was watching her with the mild curiosity of someone who had noticed that the nurse who wasn't supposed to be here this morning and then very much had now been on the floor for going on 9 hours and was taking phone calls in the corridor with a federal agent's number. "Is there someone inside this hospital?" she said. Vance said nothing, which was not a denial. She looked at the nursing station, at Deb, working her board, at Priya at the medication cart, at the overnight attending, saw Dr. Faraday, still here, running on whatever his version of reserve was. She thought about Alcott in 214 with his stabilized rhythm and his closed tablet. She thought about Gordon Fisk in federal custody. She thought about the leak from local law enforcement and Holloway's phone call, and the 90 minutes of head start that had almost cost them everything in the rack room. Who else was connected to Fisk inside the hospital, she said. Not to Vance anymore. More to herself. But Vance was still on the line, and he heard it. "Mara," he said. "Go home. Get some sleep. We have the documentation." "The documentation covers the military case and the Meridian fraud," she said. "But if there's someone inside this building who was functionally part of the network..." She stopped. "These patients are here tonight because I came back through those doors this morning. If someone in this building..." "Mara." His voice had gone quieter. Not cutting her off, just careful. "We have this covered from our end. I need you to trust that. She stood in the corridor with the phone against her ear and looked at the ER bay doors and thought about the difference between trusting that and knowing it. "Is it Faraday?" she said. Silence. "Vance, don't do anything tonight," he said. "That's all I'm going to tell you." She lowered the phone. At the end of the corridor, Dr. Faraday had stopped charting. He was looking at his own phone. His face had the expression of someone who had just received a message that required him to make a decision. He looked up, and he looked directly at her. The distance between them was 40 feet of corridor and everything that distance implied. Faraday's hand dropped from his phone to his side. He didn't move toward her. He didn't move away. He just stood at the end of the hall with the particular stillness of someone whose next decision was going to define the shape of the next several years of their life, and who knew it, and who was still working out which way to go. Mara didn't move either. She thought about what Vance had said. Don't do anything tonight. She thought about the patients in the bays behind those doors. She thought about Kessie with her rebuilt lung pressure and her 97% saturation, and Eddie Garza conscious in the cardiac ICU with his wife beside him, and Teresa Okafor out of surgery and in recovery. She thought about what don't do anything cost if she was right, and she waited. Then Faraday's phone buzzed in his hand. She could see it from 40 feet, the screen lighting, and he looked at it, and whatever he saw on it made the decision for him in a way that she didn't engineer and couldn't have predicted. He put the phone in his pocket. He looked at her one more time. Then he turned and walked toward the stairwell at the far end of the corridor, not running, just walking fast with the deliberate economy of someone who has decided on a direction and is committing to it. She called Vance before the stairwell door finished closing behind him. "He's moving," she said. "Stairwell on the east side of the building, heading down or up, I don't know which." A pause on the line. Not hesitation, the sound of rapid coordination. "We have personnel in the building," Vance said, and his voice had shifted into the register she recognized from the rack room. "Stay where you are." She stayed where she was. It took 6 minutes. She counted them without meaning to, standing in the corridor with the night shift moving around her and Deb watching her from the station with the careful expression of someone who has noticed that something is happening and is choosing not to ask yet. 6 minutes, and then her phone buzzed with a text from Vance's number. "Secured. Ground floor parking exit. Stand down." She exhaled. She stood in the corridor for another moment, the overnight hospital sounds settling back around her. A monitor, a door, the quiet industry of a building doing what it was built to do. Then she went to the nursing station and sat down in the same chair she'd used earlier and pulled up the patient board and continued the review she'd started before the phone call. Deb came and stood beside her. "Do you want to tell me what's happening?" Deb said. "Or do you want me to pretend I didn't just watch whatever that was?" "Dr. Faraday is going to need to be replaced on tonight's shift," Mara said. A long pause. "Okay," Deb said. "I'll call Dr. Waverly." Another pause. "She's going to have questions. Tell her it's an administrative matter and the details will follow tomorrow. That's all you need to say." Deb went to make the call, and Mara kept working through the patient notes, and the night shift continued around her, and at no point did anyone on the floor understand exactly what had just happened in the East Corridor, which was probably the right way for it to go. She left the hospital at 11:40 p.m. She drove home in her own car through the empty Wyoming streets, and she ate a bowl of cereal standing at her kitchen counter because it was the fastest available food, and she was past the point of caring about the form of it. She stood in the shower for longer than she needed to. She sat on the edge of her bed in the dark for a few minutes, not thinking about anything specific, just letting the day stack up in the quiet and take its shape. She slept for 6 hours, which was not enough, and was also what she had. The following 3 weeks moved the way that institutional collapse always moves, faster in some directions than expected, slower in others, with the particular grinding momentum of legal and administrative processes that were built for thoroughness rather than speed. Gordon Fisk was formally charged on the second day. Federal procurement fraud, conspiracy, and a third count related to obstruction of a regulatory audit that had been scheduled and then quietly postponed 18 months earlier. The charges were public record, which meant the Draper's Crossing Courier ran it on the front page, and Ravenwood General's board of directors held an emergency meeting that Mara was not invited to and did not need to attend. Dr. Faraday's situation moved faster than the Fisk case, which surprised her until Vance explained that Faraday had been a peripheral connection, a low-level informant who had been receiving payments from the Meridian-adjacent network in exchange for flagging regulatory concerns before they reached the board, a kind of institutional early warning system that Fisk had cultivated in the years before the federal investigation began. When the federal agents picked him up in the parking garage, he had cooperated within 45 minutes, which was the behavior of someone who had been frightened into complicity rather than genuinely committed to it. The cooperation reduced his exposure, but didn't eliminate it. His medical license was suspended pending investigation. He did not come back to Ravenwood. Trent Holloway entered a cooperation agreement on the fourth day, which was faster than Vance had predicted. The Meridian network, under the pressure of the agreement, unraveled in the specific way that structures built on concealment unravel when the concealment fails, quickly and in multiple directions simultaneously. 7 additional hospitals in 4 states were identified as part of the supply chain fraud. 3 other administrators faced federal scrutiny. The Meridian parent company's stock halted trading on the 6th day and did not resume. Colonel Dermot Sloan was served with federal charges on the 8th day, coordinated between the DOJ and the JAG Corps in a joint filing that Vance had described as unusual, which she understood to mean that someone senior in both departments had decided this needed to be handled visibly rather than quietly. The charges were procurement fraud, obstruction of military justice, and witness tampering. His attorney issued a statement through a spokesperson. The statement did not deny the charges. Mara read about it on her phone in the break room at Ravenwood, between a medication review and an afternoon shift that she was covering voluntarily because the overnight staff was short. She read it twice, put her phone face down on the table, and sat with it for a moment. 3 years. She sat with the specific weight of 3 years, and then she stood up and went back to the floor, because the floor was where she was needed, and because the weight was not going anywhere regardless of where she stood. The formal reinstatement ceremony, the Army's version of it, which was not a ceremony so much as a documented administrative process conducted in a conference room in a federal building in Cheyenne, happened on a Tuesday morning 3 weeks after the Harwick explosion. Rourke was present. Vance was present. A JAG officer named Captain Ferris managed the documentation with the thorough, methodical attention of someone who understood that paperwork was the architecture of consequence and treated it accordingly. They restored her rank. They restored her commendations. They read the reversal of the separation finding into the record, which took 4 minutes, and every minute of it was a different kind of strange. Not triumphant, not emotional in any clean way, just the odd sensation of watching a version of yourself that had been declared wrong be formally undeclared. Rourke shook her hand at the end. "The reinstatement offer stands," Rourke said. "There's no expiration on it. If you decide you want to return to active service, the pathway is open." "I know," Mara said. "And if you don't?" "Then I don't," she said. "And I appreciate that you made it a real choice." Rourke looked at her for a moment with the expression she'd had in the hospital lobby, the one that was carrying something it had held for a long time. "I should have fought harder in 2021, Rourke said. "When it was happening, I had more leverage than I used." It was the kind of admission that cost something to make, from someone for whom admission of any kind didn't come easily. Mara received it without softening it or dismissing it, because it deserved neither. "Yes," she said. "You probably did." Rourke nodded once. That was enough. The Ravenwood General Board of Directors offered Mara the interim director of clinical quality position on the 22nd day, which was not quite what the outline document had envisioned. They had discussed a director of trauma response role in the early board meeting, but interim clinical quality was what was immediately available and what they needed, which was also what the hospital needed. So it was effectively the same thing by a different name. She accepted the interim designation without the expectation that it would resolve cleanly. Institutional restructuring rarely did. What it meant in practice was that she began the work of reviewing Ravenwood's supply chain protocols from the inside, with actual access to the procurement records and the authority to flag concerns that went directly to the board rather than through an administrator who had reasons to redirect them. It meant that the medication and equipment audit she'd been unable to formally initiate as a floor nurse became something she could actually run. It meant that when she pulled the full list of adverse event flags from the last 4 years and cross-referenced them against Meridian supply batch dates, she found 11 cases, not 3, that warranted review, and she sent all 11 to the state medical board with full documentation and a cover letter that she wrote herself and did not ask anyone to review before she sent it. It was not comfortable work. Several of the cases involved physicians who were still on staff. Several involved procedures where the outcomes had been documented as standard complications and where the physicians involved had genuinely believed that to be true. Reopening those cases meant conversations that nobody wanted to have, with people who had not been complicit in the fraud, but who were going to have to live with the knowledge that materials they'd trusted had not been trustworthy. She did not make those conversations easier than they were. She also did not make them harder. She gave people the information directly, answered their questions honestly, and let the weight of it land where it landed, because that was the only version of this that served the people who had been harmed. The Ruth Kavanaugh conversation was the hardest. Mara called her directly. She had found the number through the patient liaison office and had gotten clearance from the board and the hospital attorney before making the call. She had prepared for what she was going to say. She had not prepared for Ruth Kavanaugh's voice, which was steady and careful in the way of someone who had learned in 68 years that news that requires this kind of preamble is rarely good. She told her what had happened. The supply chain, the compromised materials, the suture batch, the infection that had not been a standard complication. Ruth Kavanaugh was quiet for a long moment. "So it wasn't just bad luck," she said. "No," Mara said. "It wasn't." Another silence. "My kidneys," Ruth said. "The prolonged antibiotic course was a consequence of the infection severity," Mara said, "which was a consequence of the compromised material. That connection is documented in the audit." "I told my daughter it was just one of those things," Ruth said, "that sometimes the body just reacts. I told her that for 2 years." Mara sat with that. "You have the right to pursue civil remedies," she said. "The hospital's legal office can provide you with information about the process. That's separate from anything the hospital is initiating. It's your decision and your timeline." "I know about civil remedies," Ruth said, with the dry, precise tone of someone who had just communicated a great deal in 4 words. "What I want to know is whether the people responsible are going to face something real." "Yes," Mara said, "they are. Federal charges, named outcomes, not a settlement that disappears into an NDA." A pause. "All right," Ruth said. "Thank you for calling me yourself." She said it the same way Danny's mother had said thank you, plainly, without performance, the kind of gratitude that meant something because it hadn't been dressed up. Preston Alcott came back from cardiac leave 5 weeks after the Harwick event. His stress echo had shown moderate ischemic disease in the LAD territory, not requiring immediate intervention, but requiring medication adjustment and a formal conversation about surgical volume and operative hours that his cardiologist had apparently delivered without softening. He came back to Ravenwood on a reduced schedule, 4 days a week instead of 6, and in the first week back he did 3 things that Mara noted without commenting on. He attended the first mandatory clinical quality meeting she ran. He sat in the back and said little, but he was there and he was paying attention. He filed a voluntary disclosure to the medical board about the cases where his decisions had intersected with the Meridian supply period, which his attorney had advised against, and which he had done anyway. And on a Wednesday morning in her 3rd week as interim director, he knocked on the office door she'd been given, a small room off the administrative corridor that smelled like old coffee and had a window that looked at the parking structure. And he stood in the doorway with his hands in his coat pockets. "I wanted to say something," he said. She waited. "What happened in my ER on the morning of the Harwick event?" He stopped. "I've been practicing surgery for 19 years. I've worked with hundreds of nurses. I've never, in the field situation we were in that day, I have never seen anything like what you did." He said it with the specific difficulty of a man who did not give this kind of acknowledgement often and was aware of how long it had been delayed. "I was wrong about your capability. I was wrong about your judgment. And the way I operated, the complaint, the suspension, was driven by something in me that I don't have a flattering name for, and I've been trying to find one and there isn't one. She looked at him. "I know," she said. "I'm not asking for—" "I know you're not," she said. "I'm not forgiving you in the cinematic sense, if that's what you're waiting for. What happened in the ER that morning happened because we were both there and both doing our jobs and the situation required it. That's what I'll remember." She paused. "The rest of it, the 14 months of friction, I'm going to spend some time with that, and I'll come to my own conclusion about what it means, and it won't have anything to do with this conversation." He looked at her for a long moment, then he nodded. "Fair," he said. He left. She turned back to the audit document on her screen because the audit document was still there and still needed finishing, and because that was the actual work, and the actual work was what she'd come back through the doors for every time. The day the federal grand jury returned indictments against Sloan, Holloway, Fisk, and 4 Meridian executives was a Thursday in late November, 6 weeks after the explosion. Vance sent her a text with the case reference number and a single line, all 6, full counts. She was in a staff meeting when it came through. She read it under the table, put her phone away, and finished the meeting. And then she went to the break room and stood at the window that faced the parking lot and looked at the November sky over Wyoming, which was the specific gray of a sky that had not decided yet whether to snow. 6 people. Full counts. A fraud network that had been running for 9 years across 40 hospitals through a military supply chain into a court-martial that had been designed to disappear one inconvenient witness who had noticed that the numbers didn't add up. She thought about the Corrigan staging area. She thought about standing in front of a JAG panel and speaking the truth into a room that had already decided what the truth was going to be. She thought about the drive from Phoenix to Draper's Crossing, Wyoming, the specific decision to go somewhere small, somewhere quiet, somewhere nobody would look too hard. She thought about Danny Kowalski and his wide dark eyes and his skateboard and the bleeding in his skull that had been slow enough to look like tiredness. She thought about a specialist named Okafor who had filed a citation for an action that had taken 4 seconds and had then spent years in the machinery of a task force waiting for the right moment for it to matter. Some things took a long time to resolve. That was not the same as saying they didn't resolve. She went back to work. Opatit. The thing that nobody tells you about vindication, the thing that the word itself obscures, is that it doesn't feel the way you imagine it will feel when you're carrying the wrong version of your own story. It doesn't feel like a door opening or a weight lifted or any of the spatial metaphors that people use when they're trying to describe internal experience through physical sensation. What it actually felt like for Mara was closer to a recalibration, a slow return to a frequency she'd been running at below audible range for 3 years, finally coming back up to where she could hear it clearly. She was still tired. She was still imperfect, impatient with bureaucracy, occasionally abrupt with people who asked questions she considered wasteful, prone to working past the point of reason and calling it discipline when it was sometimes just avoidance. The record was cleared, but the character was the same character, which meant the same person who had walked back through those doors on the morning of the Harwick event was the same person who sat in the interim director's office and ran the quality audit and returned Ruth Kavanaugh's call. She didn't think that was a failure. She thought it was actually the point. Because the skills that had let her see Danny Kowalski's subtle presentation and argue for the right scan had not come from a credential or a citation or a formal acknowledgement. They had come from years of paying attention in rooms where she was not supposed to matter, from learning to be right in a way that survived being dismissed, from developing the specific, durable confidence of someone who has been told repeatedly that what they know isn't real and has discovered repeatedly that it is. The institution had not made her capable. It had tried for 14 months to make her smaller, and she had simply kept being exactly what she was. That was not a special power. That was a choice. The same choice, made again and again in the small, pressured moments before anyone was watching. In the medication cart at 6 in the morning, at a patient's bedside at 2 in the afternoon, in a parking lot in October with the engine running and a pressure wave in her chest that she recognized before her ears did. The choice to know what you know and act on it, even when the room says otherwise, even when they take your badge, especially then. On the 53rd day after the Harwick explosion, Kessie Drummond was discharged from her follow-up pulmonary appointment with a clean bill. She had been coming in every 2 weeks, and she arrived for this appointment with her hair in a different style and a slightly different posture. Something in her had reset from the terrified 19-year-old in the hallway chair to something that was still 19 and still a little frightened of things, but had learned in the last 7 weeks that frightened and capable were not mutually exclusive. She stopped at the nursing station on her way out. Mara happened to be there, reviewing a chart, which was not her official function as interim director, and which she continued to do anyway because she was constitutionally incapable of being in an ER and not reading charts. "I'm cleared," Kessie said. "I know, I saw the note." "I got a new job," Kessie said. "Different facility, not industrial. I'm going to try office work for a while." "That sounds like a reasonable plan." Kessie looked at her for a moment with the direct, slightly unfiltered honesty of someone who had not yet learned to wrap things in social cushioning. "You saved my life," she said. "I gave you a needle decompression," Mara said. "Your body did the rest." "That's not what I mean." Kessie's voice was patient in the way of someone who has decided they're going to say a thing and a deflection isn't going to stop them. "I mean, you came back. They took your badge, and you came back anyway, and because you came back, I'm standing here." She paused. "That's not a small thing. I'm going to think about that for a long time." Mara looked at her. 19 years old, clean lung pressure, whole future still open. "Take care of yourself," Mara said. Kessie nodded and walked out through the main doors, and the automatic doors closed behind her, and the lobby settled back into its ordinary morning frequency. Mara stood at the nursing station for a moment. Then she picked up the chart she'd been reading and continued, because the next patient was already there, and the work was already in front of her, and that was how it had always been. Not a dramatic turning point, not a single moment of recognition that changed everything, but the accumulation of individual decisions made in the space between dismissal and response, between what they say you are and what you actually do. She had walked back through those doors because the situation required it, and she was capable of what the situation required. That had been enough. It had always been enough. The work continued, and she was exactly where she was supposed to be, doing exactly what she had always known how to do, in a building that had tried to tell her otherwise and had been wrong. She turned the page.